Let's continue our discussion on the accumulation or the Xi points. Today we discuss bladder 64, the Golden Gate point. So bladder 63 is located on the lateral aspect of the foot, proximal to the tuberosity of the fifth metatarsal bone, in a depression anterior and inferior to bladder 62, between the calcaneus and the cuboid bone. We have to note that some authors locate bladder 63 between the cuboid bone and the tuberosity of the fifth metatarsal bone, as shown on the figure at the right. Bladder 63 is the most tender point. So how to find bladder 63? When palpating along the lateral aspect of the foot on the level of the border of the red and white skin, a bony structure can be felt approximately at the midpoint of the foot. This is the tuberosity of the fifth metatarsal point. Slightly proximal to it and towards the heel, we can palpate a depression between the calcaneus and the cuboid bone. There we locate bladder 63. And bladder 64 is located distal towards the toes to the tuberosity of the fifth metatarsal bone. Bladder 63 is needled vertically 0.3 to 0.5 tune. Its actions and indications include open the channels, alleviates pain, and eliminates stagnation as the Xi-Cleft point. And it also subdues internal wind and calms the Shen. As its special feature, it is the Xi-Cleft point of the bladder meridian, the meeting point of the Yang Wei Mai. Like all accumulation points, bladder 63 is used in acute cases to stop pain. Judging from the indications, this effect of this accumulation point is limited to channel problems, and surprisingly, this point does not have any urinary indications. However, it can be used in acute bladder patterns to clear heat and stop pain for such symptoms as frequent and burning urination. To summarize its function, bladder 63 removes obstruction from the channels in lower back ache, knee pain, painful obstruction syndrome or the B syndrome of the legs, pain in the legs, and pain on the external malleolus. This point can relieve urinary pain in acute urinary problems. Bladder 63 is the Xi-Cleft point of the bladder channel. The Xi-Cleft points where the qi and blood flows relatively superficially along the channels from the Jingwell points gather and plunge more deeply, are applicable in the treatment of acute conditions and pain. Bladder 63 is indicated for sudden onset of severe Shan disorder, sudden turmoil disorder with cramps, epilepsy, and white tiger joint pain, a manifestation of painful obstruction characterized by the great severity of the pain, which is likened to a bite of a tiger. Despite its status as the Xi-Cleft point of the bladder channel, bladder 63, like most of the distal points of the channel, was traditionally ascribed no action on disorders of urination. In this respect, the bladder channel points are similar to those of the small and large intestine and Sanjiao channels, whose points also have little action on their related Fu. Bladder 63 can be used in combinations with other points for different indications. So for cramping of the sinews, bladder 63 can be used with GB40. For contraction and cold of the shoulder and back with pain of the inner aspect of the scapula, bladder 63 can be used with bladder 17, bladder 45, and lung 5. For bilateral deafness due to injury by cold, bladder 63 can be used with gallbladder 2. And finally, for deafness, bladder 63 can be used with gallbladder 41, and LI4. So thank you for your attention.